So when applying restraints, first we're going to assess the patient, check their mental, their normal physical condition, and their behavior to see if they actually need the restraint. Once we've determined that, we've already exhausted all non-invasive ways to calm them down or get them to be cooperative. We will make sure we obtain an order from a physician and that it's in the required amount of time. Once we've gotten that order in hand and document, then we'll go to the patient, identify them with 2 identifiers, perform hand hygiene, and explain them what is going on. So I'm going to be giving restraints because they keep pulling out an IV or they're being combative and we can't calm them down. And then once we've done that, we're going to also explain like this is just a temporary thing, make sure that their vital signs are still normal and all of that. So for this demonstration, we're going to be doing a Velcro wrist restraint. And so what we're going to be doing when we do that, we're going to be putting it on the wrist, make sure that it's all padded, make sure that if there's any bony prominence that it's definitely padded, and so we can preserve the skin integrity. And for this purpose, this is going to be Velcro. And what we want to do is make sure that once it's attached, that you can fit 2 fingers in between the restraints and their skin. And then when you're tying the restraint to the bed frame, you want to use a slip release knot. So this is the bed frame for this purpose. Make sure that it's tight enough, and that also the bed is obviously up at this point, so I'm not hurting my back. And then once it's done, we see that it's attached. This is slip release just in case there's an emergency. I'm going to make sure that her call light is always in reach. And then once all that's done, I'm going to perform hand hygiene. I'm going to assess my patient every hour to make sure that her vital signs are still normal, she's not having a panic attack or having hallucinations, or she's not getting depressed. Then every 2 hours, I'm going to do range of motion, remove the restraints, and determine if the patient still needs restraints at that time, or make sure that the orders are still valid. And that is how you put restraints on.